Hi, I'm Walter Mashman from Atlanta, Georgia, and I'm here for Jack Cardiovascular Interventions. We have with us Dr. Shami Mahmood from San Diego, who's going to speak with us about a very interesting paper that he's just authored and will be published shortly. Shami, give us please some background about why you chose to do this study.
So Walter, one of the key problems that exists with renal artery stenting is we have patients who are hypertensive, they have renal artery stenosis, and and not just us, but nationwide, there's been a sharp increase in the incidence or prevalence of renal artery stenting. However, we haven't been able to identify good biochemical or angiographic parameters that predict which patients are likely to respond, i.e. improvement in blood pressure control or improvement in renal function. And so that was the background behind why we decided to do this study.
Okay. And historically, what measures have we had to assess renal artery stenosis and its significance?
So there are angiographic factors, and generally speaking, more than an angiographic stenosis of 70% or greater. Pressure gradients across the stenoses, and most of us feel a peak systolic pressure gradient of greater than 20 millimeters of mercury is a hemodynamically significant stenosis. Renal fractional flow reserve is a newer concept which has still not been completely validated. And Chris White did a very interesting study where they looked at BNP levels, and they saw that patients with renal artery stenosis and a BNP greater than 80 were more likely to respond to therapy, i.e. stenting with a reduction in blood pressure.
So you looked at renal blush grade and renal frame count. Could you describe for me how those are measured and who can do that? Can that be done in every lab?
It actually can, and it was a very simple method that we defined. The renal frame count has previously been defined in a very small manuscript, and we went on and used that same methodology. And it's acquiring images at 30 frames a second. And the first image is when you have complete opacification of the renal artery. And that counts as your first frame. And if you're acquiring at a frame rate of 30 frames a second, then the number of frames it takes for contrast to reach to the distal cortical vessel, which in normal patients we define to be around 20. Normal meaning patients who were hypertensive with risk factors for renal artery stenosis but did not actually have a hemodynamically significant stenosis, so not quite normals, but patients who we used as the control group who had essential hypertension likely without renal artery stenosis. In those patients, the number of frames it took was 20. Renal blush grade is more of a measure of microvascular clearance of contrast as opposed to large vessel flow, and we graded that between 0 and 3, and the manuscript goes into details, but fundamentally a 0 blush grade would be somebody who has no contrast or opacification of the cortex. 1 would be a hypoperfusion of the cortex, and 2 is normal. 3 means that you have hyperemic flow and clearance of contrast by the time you measure. We measured this at 2 seconds after initial injection, so frame 60.
Tell me very briefly just the design of the study. You defined the control group. Tell me about the study group very briefly and the major conclusions, please.
Okay. So the control group I already defined. The study group were a consecutive series of patients really who had undergone renal stenting in our cath lab who met the inclusion criteria, so they had to have adequate images, and there were some exclusions that we took out, like patients with advanced renal failure or obviously images that were inadequate to measure frame count or blush grade. So 24 patients in whom we were able to measure pre- and post-procedural frame count and blush grade, and all of these patients had 6-month clinical follow-ups to evaluate their blood pressure at follow-up. And our main findings were that as a group, they had a 20 millimeter systolic blood pressure reduction at follow-up, along with about a 6 frame count reduction between pre- and post-procedure, and a blush grade that went up by 0.5. What was most interesting is when you then divided the responders, which we defined as somebody who had at least a 10% reduction in systolic blood pressure, the group of patients who were responders tended to have higher baseline frame count, 25 or greater. Secondly, they had a 6 to 7 frame count reduction, while the non-responders tended to have a less than 25 baseline renal frame count and almost no change in their frame count before and after the intervention. The changes in the blush grade were less predictive.
Shammi, it's a fascinating study and a very important study, and I really appreciate you taking the time to be here with us. For Jack Journals, this is Walter Mashman. Thank you.